Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Self-instructions. Self-instructions are the emission of a series of stimulating messages that consists in giving oneself the necessary instructions that allow the realization or the coping of a certain task, situation, or event. Training in self-instructions aim for the patient to learn to establish concrete and correct self-talk about certain situations, tasks, or events of coping. Don't confuse the concrete moments, the urge to smoke, with the consequences that come with that decision. To just smoke one cigarette, you will pay a very high price. There is not a single cigarette that is false. So stop kidding yourself and assume their reality. Smoking is over for good. If you smoke just one cigarette, you will fall back into the cycle of addiction, and all that goes with it. Self-instructions for tobacco are a guide to help the patient and prevent them from falling back into addiction. Steps in making the decision to quit smoking. Quitting smoking represents the most important step you can take to live longer and improve the quality of your life. What do you smoke? The important thing is to be able to stop smoking. And to be able to stop smoking, you need to know two things about your personal relationship with cigarettes. 1. What does tobacco give you to continue smoking, in spite of wanting to quit? 2. For what reason do you want to quit smoking? That is, what do you think you will gain from quitting? Start by finding out the reasons why you continue to smoke. To answer the first question, it will help to know how often you identify with each of the following circumstances. In the following table, circle the option with which you most identify, and remember to mark only one option for each of the circumstances described. Write down the score you have marked for each situation with a circle in the spaces provided. For example, if you have marked 4 for situation A, put A4 in the space reserved for A, and so on. Add the 3 scores you have put on each line to get a total per line. Each total will give you your position in each of the possible reasons. Total scores can range from 3 to 15. Scores of 11 or more indicate that this category describes in a very important way the reasons why you continue to smoke. Once you have identified which categories best define you, will indicate how this information can help you better understand what you gain from smoking and better initiate your plan to change your smoking behavior. In any case, clearly identify what are the main characteristics of your dependence or what is the same. Some of the powerful reasons why you continue to smoke will help you face the first days without smoking. So take notes, because we'll come back to them later on. Category 1. As a stimulant. If you score high in this category, you feel that tobacco helps you to clear your head, maintain a high level of attention, stimulates you, increases your energy, and in general helps you to keep going. This video will help you know that you can regain a normal level of alertness and activity without smoking. Category 2. As a gestural reinforcement. Sometimes having something between your fingers is rewarding, helps you to cope with more poise in some situations. You feel it gives you more presence, or you just find it entertaining. This video will help you find alternatives. Category 3. For pressure relaxation. It is not always. It is easy to distinguish whether you smoke to feel good or to avoid feeling bad. About 2/3 of people who smoke tend to score high in the pleasure relaxation category. Category 4. To reduce negative states. If you scored high in this category, it is because you often believe that smoking helps you to overcome difficult moments, stress, or daily problems. From now on, you should know that the one who overcomes the daily problems is you, and not the cigarette. Category 5. Addiction. You know you have a strong addiction, but when you achieve it, you will realize that in reality you can do more than tobacco. You will greatly value your achievements, and you will feel that it is not worth it to go back to the situation of previous dependence. Here, you will learn how to achieve it. Category 6. By automatism. You no longer enjoy the majority of cigarettes you smoke. Your relationship with tobacco is unconscious, mechanical, and automatic. Your main objective now is to break the unconscious associations that you have established between the acts of smoking and your daily habits. With this video, you will learn how to break these automatisms. If you're interested to continue learning about clinical hypnosis, watch our next video. Value the advantages of quitting smoking. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks too. If you have questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.